As COVID-19 numbers climb, some patients face a difficult question. How are they going to pay for all of this?
87 million Americans are uninsured or underinsured.
The high cost of U.S. healthcare services had been a hot topic even before the pandemic. But as the virus rages on, millions of Americans are underinsured or have no insurance at all. NYU junior Angel Mancia is one of them.
Originally, I wasn't planning on coming home because my parents they're getting on the older side and I wanted to make sure they were safe.
But when NYU closed the dorms, Angel had little choice. And once he got home to Long Island, his parents came down with the virus.
They got pretty bad, I'm not gonna lie. I got really lucky that they bounced back, but there was some scary moments where I thought we would have to drive them to the hospital and stuff.
Mancia and his sisters, who had previously been on a Medicaid-covered health insurance plan, found their coverage suddenly canceled a few months earlier.
It was scary. It was scary knowing that if it were me or my sisters that had to go to a hospital or something like that, it would not have been possible. Like, we wouldn't be able to afford it at all. Like, I think the ambulance ride alone would put us into a really, really bad position.
University of Illinois junior Hannah Rafi's parents also don't have medical insurance. She worries a bad case of COVID could shatter her family.
If someone gets sick, then, someone has to go to the hospital. But then they would get these bills. But if they stay home, then everyone could get sick. And then everyone could die, or, the whole family could end up in the hospital, and then, the hospital bills would be even more. So it's, how do you decide? So I'm just, really hoping that no one gets the virus.
But Hannah knew that if one person in her family gets sick, they all likely will. There is no way for them to wall off the virus.
We live in a 2-bedroom apartment. I share a room with 3 sisters, and then there's my 2 parents in the other room. So if someone had to be quarantined, I don't even know how that worked, within the house.
Dr. Mary Marthese, my aunt, is a family medicine physician who works at UCLA with low-income communities.
I think the hardest thing is they just don't know where to go, or they're afraid of emergency room costs, because that's all we talk about in the media is that insurance or emergency rooms are so expensive. What they don't know is that they can't put you in jail for not paying an emergency room bill. But nobody likes to have that hanging over their head.
The unemployment rate rises to 14.7%.
With layoffs rampant and her own job at risk, Hannah worries her family would have no way to pay back medical bills.
What if I go to the hospital, I'm in debt, and I lose my job, and I still have to pay for all of that?
Angel says the virus lays bare the stark reality of the country's economic divide.
I don't think the virus has shown me anything I didn't already know. I think it just cements the fact that it feels like they don't really care. It feels like I am dispendable.
In the meantime, Angel and Hannah, along with millions of other college students, will do their best to stay healthy by staying home. For NYU Tonight, this is Sarah Pat.